Good evening, doctors. I am Shalendra Meena from FDC Limited, and I welcome you all to day 2 of this 10-day long e-learning module on post-COVID complications. In yesterday's topic, respected Dr. KK Agarwal laid the foundation of this 10-day long journey and discussed about COVID inflammation plus cytokine deregulation. And as you know, we had quiz for every session. So I'm happy to announce the winner of yesterday's quiz, Dr. Manisha Dhinge from Pune and Dr. Dhirendra Samidhya from Ahmedabad. So congratulations to both of you. And now for today's session, the topic is COVID thermoregulatory deregulation. So without taking much time, I'll hand over the session to our eminent speaker, Padam Sri Dr. KK Agarwal. Sir, the session is all yours, sir. Thank you very much.
And thank you, the winners of yesterday's quiz. This is more of an educational course for the healthcare providers, but we are also making it open in the Facebook and digital media with the basic purpose of sensitizing the public about post-COVID complications and also sensitizing the healthcare providers. Yesterday, we talked about COVID-19. We said the first 9 days are viral phase and 9 to 90 days are post-viral phase. You can call them as long COVID case. And after 90 days, you normally will be considered as a non-COVID person. During this period, when the virus is dead, the virus is attenuated, the virus is killed, up to 90 days, large number of people, up to 30% of the people says they are not well. We will be talking about these 30% of the people over the next 9 days, including today. That means in a total of 10 days. Today we are focusing on fever. Majority of the people says that my virus is gone, but my fever is lasting. The characteristics fever is less than 99 or less than 100, comes in the afternoon, goes back in the evening. It will last for a couple of hours. During this period, they may feel tired, they may have muscular pain, they may have pain below the knee. Now, typically, this is not fever because fever is defined as a temperature more than 100.4. Then what it is? Let's see it in the form of few slides, and then we will understand the whole thing in great detail. So this CME, just 1 second, there is something in the computer. So this is COVID thermoregulatory deregulation. So we need to understand two types of fever we are going to understand today. So first of all, let's understand what is fever. It's an inflammatory response to an injury. That injury can be external or internal. But the most important thing is fever is defined as anything more than 100.4 degree Fahrenheit. If it is less than 100.4, it is not called fever. You can call them as elevated body temperature, or you can call them as mild fever. Up till now, Whenever we say mild fever, low grade fever, we used to call them as in India TB, TB, and TB. Evening rise of fever, 99 fever, malaise, weakness, lasting for 2 weeks, 3 weeks, 4 weeks. Till today, our learning has been persistent low grade fever means tuberculosis in our country. But this virus behaves like that, and now it is coming into a differential diagnosis of low grade fever. Normally, a fever of more than 103 is high fever, and 105.8 is very high fever. In COVID 19, if the fever is more than 101, it is pakka pneumonia. And if it is more than 103, it is severity of pneumonia will go on increasing the fever. So therefore, if the fever is less than 100.4, it's a viral response. And if the fever is more than 101, it is a severe cytokine response causing fever. So remember, low grade fever, evening rise, apart from TB, now we know COVID 19 is a differential diagnosis. On today's date, anybody who is having low grade fever, take it for granted he or she will come out to be COVID 19. Now, how does fever happen in the body? Fever in the body is because the fever is regulated by hypothalamus. This is called thermoregulatory center. This is called thermoregulatory center. You can see this is my thermoregulatory apparatus for my AC. It maintains my temperature. Now you can see here it is written as 24. I can make it 25. Manually, I can convert this thermoregulatory mechanism for my heater or air condition. This center in my body is in anterior thalamus. Therefore, this thermoregulatory mechanism, if it gets deregulated, then I will end up into a fever. Normally, this thermostat is set up at 37 degree centigrade, which is almost like 98.4, with a diurnal variation of about 1 degree centigrade. So normally, I will have fever 1 degree higher in the evening. And therefore, if this regulatory, if this thermo hypothalamus is reset, I will start getting evening rise of fever. Actually, the rise of fever is the whole day, but in the evening, I feel it. So therefore, this virus will change the setting of my hypothalamus thermoregulatory system, and I will start experiencing fever in the evening. Now, there are two reasons for fever. One is direct exogenous pyrogens. That means bacteria or viruses producing toxins, and that toxins crosses blood-brain barrier and causes fever. But in this condition, this is endogenous pyrogens, which are called cytokine fever. Yesterday we talked about cytokine wave and cytokine reaction. Today we are talking about today we are talking about exogenous pyrogens, which are toxins, and endogenous pyrogens, which are cytokines. And yesterday we talked about cytokine wave and cytokine crisis. Because they are called cytokines, which produces fever, therefore they are called pyrogenic cytokines. Yesterday also we talked about anti-inflammatory, pro-inflammatory and inflammatory. So today we will understand there are cytokines which produces fever. For that, a cytokine will have to cross blood-brain barrier. For that, it has to reset the thermostat. And the main cytokine is IL-6. Tumor necrosis factor also does the same. Interleukin 10, which is called good cytokine, reverses it. So basically, you will see there are two cytokines which are initially which causes fever, IL-6 and tumor necrosis factor. And later on, through NLRP pathway, through macrophages, IL-1 beta comes in. IL-1 beta is the one which causes high-grade fever. So the IL-6 fever usually will be a low-grade fever, thermostat dysregulation, IL-6 crosses blood-brain barrier. So these are the people who will say, I have a low-grade fever which may persist for up to 3 months. This low-grade fever may not respond very well to paracetamol. The person will say, I swear that I respond better to either mefenamic acid or naproxen. Some people says, I feel better to indomethacin. Now, this response of fever reminds us of ankylosing spondylitis or inflammatory spinal arthritis, where the fever responds better to mefenamic acid. Therefore, low-grade fever is, you can remember it as an IL-6 fever, interleukin-6 fever, clinically high CRP, tumor necrosis factor. The fever will respond better to mefenamic acid compared to paracetamol, and this fever may persist for 1 month, 2 months, or 3 months. Gradually, the fever will subside. But there is also one more fever, which is high grade fever, fever more than 101. And if that happens, we know IL-1 beta has come in, NLRP pathway has come in, and that fever also will respond only to mefenamic acid. Therefore, there are two types of thermodysregulation seen in COVID-19. Most of the people will have low-grade fever, less than 99.5. The fever will come in the evening hours. They will be better. It may come only for 3 hours, 4 hours. Myalgia, and the myalgia is particularly below the knee. They says, I have a pain below the knee. And many patients will have fever arising on third day. Any fever after third day, which is more than 101, will always be accompanied by an CRP of more than 10. These are the people who have 100% pneumonia. So indirect, those people who can't afford CT scan, pneumonia can be diagnosed by three things: cough appearing on third day, CRP more than 10, and fever more than 101. More the fever, more the cytokines, more the more the cytokines, and more the fever. Now remember, the first day fever, when you have fever appearing on first day, take it for granted it is gamma interferon fever. This is much before TNF alpha produces fever, and this pyrogenic produces fever also will be a low grade fever. So therefore, how to remember? So we say IL-6 is the likely trigger of the hypothalamic center. This fever will be low grade, and when we have IL-1 beta coming in, the fever may become higher, which indicates more inflammation. That means the fever has reached the lungs. Exogenous pyrogens. So whenever the virus enters, who secretes IL-6? Who secretes tumor necrosis factors? They will be primarily monocytes, neutrophils, and lymphocytes. Therefore, if you have a patient where you find TLC is low, total leukocytic count is low, and lymphocytes are also low. Normally, in a viral infection, lymphocytes should increase. TLC should be lower and lymphocytes should be more. But here, the first response is attraction of polymorphs. So there are more polymorphs. Lymphocytes, specifically CD8 cell, are used. So there is a low lymphocyte count, and we call clinically a ratio called NLR ratio, which is neutrophil to lymphocytic ratio. If the neutrophilic to lymphocytic ratio is more than 3.18, you say this is an active cytogenic reaction. It's a sign of replicating virus. How do you know my virus is replicating? It means polymorphs are more, lymphocytes are low, total count is low. So more polymorph reaction and consumption of lymphocytes leading to reversal, that means more P and less L, would indicate a replicating virus, high viral load. Therefore, at that particular moment, you know that you need to have more anti-inflammatory drugs. And at that particular moment, in the first 48 hours, giving a antiviral is justified. If you want to give an antiviral, which can be a favipiravir, then the justification is in the first 48 hours when you can demonstrate either the CT value of RT-PCR is very low, that the viral load is very high, or you can demonstrate continuously lowering lymphocytic count, which are consumed because the viral load is high. You can justify giving favipiravir at that particular moment. Now, coming back to those people who are scientists, how does interleukin 6 work on the hypothalamus? These are TLR. There are two types of receptors, toll-like receptors and nod-like receptors. I've talked about NLRP, that is nod-like receptor 3. There are three proteins attached to that. And this is called toll-like receptors. In subsequent discussions, these terms will come again and again. So wherever there are TLR, interleukin 6 will go and act and produce fever because of hypothalamic involvement. This is just pathogenesis, that hypothalamic deregulation involves an area called OVLT, which is organum vasculosum of the lamina terminalis. Very good to speak about. If you start speaking about it, the patients will say the doctor knows a lot of things. Why I am talking about this terminology is there are thermosensitive neurons. Now, in some people, you will find patient will say that I'm feeling cold, I'm feeling shivering. Some people will say I'm having fever, and some will say my temperature is on the lower side. So this thermostat, depending upon where it is reset, higher value fever, lower side it may have a shivering. Obviously, if the patient is shivering, we have ruled out thyroid, subclinical thyroiditis, because if they have subclinical thyroiditis, may also feel chills. But this is a very common observation. Patients will say, my temperature is going down, I'm feeling chills, but I don't have rigors. All the time I'm feeling like unexplained chills lasting for a month, 2 months, or 3 months. Remember, whenever there is a deregulation of hypothalamus, it may take up to 3 months to reset. Therefore, after you have the virus is gone, after 9 days, low grade fever or low grade shivering can continue for up to 90 days. I have seen them only in one patient, it crossed 120 days. All other patients is disappear by 90th day. And this is not an indication that the patient is infectious, because this is not a exogenous viral fever. This is endogenous cytokine fever. So when you write a cytokine fever, it means it has nothing to do with the virus. These cases can be given clearance to work. The virus is gone. They can go on duty. And if you are a doctor, if you have this, you can work and go for a duty with that. Now, these are another ways the endogenous pyrogen works. They also work through prostaglandins, specifically prostaglandin E2. So there are multiple pathways. One pathway is they work through the hypothalamus. But if they work through other pathways like prostaglandin E2, TLR, NLRP, which we have just spoken yesterday, we discussed in great detail about phospholipid pathway and NLRP pathway. And in a phospholipid pathway, we talked about PGE2. So apart from the hypothalamus, fever can also come because of prostaglandins, because of NLRP. Therefore, the role of colchicine, mefenamic acid also comes. So high-grade fever basically may involve alternative pathways leading to 101 or 103, which will indicate a severe cytokine response leading to fever. Now, for fever, there is a behavioral response, and that is patients start seeking a warmer environment or covering up with a blanket. The body may initiate heat conservation by vasoconstriction and heat production by shivering, and so many other things can start happening. We don't want to go into details with that. And this is again when PGE2 is formed, non-specific myalgias and arthalgias can come. So if somebody says, I have myalgia, then you can say this is PGE2 fever. So now we have seen IL-6 fever, which is low-grade fever, 99 fever. Then we know high-grade fever, which is NLRP or prostaglandin fever. And here we say whenever there is a myalgia, therefore these myalgias responds to mefenamic acid because they are prostaglandin E2 fevers associated with myalgias. Remember characteristics of this myalgia. It is typically below the knee. Normally, you should have a myalgia all over the body, but most of the people will say, घुटनों के नीचे दर्द हो रहा है. And they say it responds to mefenamic acid. Now, coming back to treatment of fever, we have choices of paracetamol, we have choices of naproxen, we have choices of indomethacin, we have choices of mefenamic acid, we have choices of nimesulide. Now, this slide I have got it from Dr. R.K. Sanghvi. In one of the seminar, in the evening session, he participated. Now you can see there are IL-1 beta, IL-6, IL-8, 18, TNF-alpha, NLRP. These are all the compounds which can produce fever. These are all the compounds which can produce fever. IL-8 is the one which increases polymorphs. We don't have a drug which reduces polymorphs. But mefenamic acid, if you will see, it works at most of the levels. Most of the levels. There is no drug which increases IL-10, which is a good cytokine. But otherwise, if you see, mefenamic acid is one such drug which works. Paracetamol may not be effective in cytokine fevers always. And if it works, you may have to give the double dose. This is just when you are giving a lecture, you always want to show that I know so many things, but this is just what I have spoken till now. So I am going to come back to this slide again. So just let me summarize that there is a thermoregulatory mechanism in my body, and that thermoregulatory mechanism can be disrupted by endogenous pyrogens called cytokines. They are gamma interferon, they are TNF alpha, they are IL-6, they are IL-8, they are IL-18, IL-1 beta. Now, somehow or other, you will have to remember all of them slowly. By 10th day, you will be an expert in understanding these, because everywhere these terms will come when we want treatment. So therefore, purpose is to reduce IL-6. Don't do anything. Automatically, if it is a low-grade fever, 97, 98, even if you don't give anything, people will automatically become all right. So whenever a person in a post-COVID phase has fever, ask them, what is the CRP value? If the CRP is high, normal CRP should be less than 1. If it is 1 to 3, then it is a low-grade inflammation, may not produce fever. But if it is more than 3, you know that these cytokines are producing fever, and CRP is linked with IL-6. Therefore, low-grade fever with high CRP will require treatment. And if the fever is very high, then you know IL-1 beta, IL-8 also has entered. Then you will need to give them either steroid to act at PLA2 level to reduce TNF alpha, or you will need colchicine or mefenamic acid to cover other points. But most of the time, 90% of your patients will say, I have a post-COVID fever, low grade, nothing need to be done. I normally tell them that don't start measuring your temperature, the temperature will go away. If your CRP is normal, that means the cytokines have gone away. While going away, they have not corrected the thermostat of the hypothalamus, and that fever may slowly disappear. To summarize, if your fever is low grade, less than 100 or less than 100.4, CRP is normal, you have crossed 9th day, just watch and wait, your fever will gradually subside. You can take high dose vitamin C. Number 2, if your fever is more than 100, less than 100.4, CRP is positive, in that situation, you may like to give an anti-inflammatory drugs. You may have a choice of mefenamic acid, or you may have a choice of colchicine. But if the fever is more than 101, you know IL-1 beta has come, TNF alpha has come, you may have to give them corticosteroids with or without mefenamic acid. But don't forget anemia. Don't forget loss of iron. In COVID-19, every patient ultimately will develop, most of the patients ultimately will develop a fall of hemoglobin by 1 to 2 grams. Therefore, the role of vitamin with B12, B6, folic acid, and 100 milligram of elemental iron definitely will come. So all patients in a post-COVID phase, don't forget to give them a combination of elemental iron with B12, with B6, and with folic acid. Because in a small intestinal involvement, they will end up with anemia, and that anemia itself sometimes can cause exertional fever. Also remember that most of the people who have a low-grade fever will say their fever gets precipitated by exertion. They would say 6-minute walk test, the fever gets precipitated. And today, to be last, I've also discussed when to give an antiviral. Antiviral should be given in the first day or second day when the virus is still replicating, lymphocytes are reducing, polymorphs are increasing, CRP is rapidly rising. Now let's come back to the question of the day today. The question of the day today is the storage form of iron is the storage form of iron is transferrin, ferritin, hepcidin, or porphyrin. You have a chat. You can answer your questions in the chat. So you have a chat. You can answer your questions in the chat. Let me see. There, I have tried to cover most of the questions which have been asked by the public. I have thousands of questions coming in to my list. So, so most of the questions have been covered by me, and still questions are coming. I will try to cover them over a period of time because we are interacting with you for the next 9 days with that. Let me see some more questions if they have come. No, the questions haven't come. Most of the questions I have covered. So I'll hand it over to my colleague, Shailendra Meena, to sum up and give the final comments. Shailendra.
Thank you, sir. Thanks a lot. It was a wonderful, wonderful session and enlightening session on thermoregulatory deregulation in COVID. And I'm sure every healthcare professional who attended today got a good conceptual understanding about the topic, sir. I would also like to thank all the doctors who attended today's session, and I would like to remind them about the tomorrow's session at the same time to 8:30 tomorrow with the most important topic post-COVID lung. And lastly, I would like to thank the team IJCP and their technical team for wonderful execution and organizing this session without any technical glitch. Thank you, sir. Thank you very much, and good night.
So thank you, Shailen, and we'll be back tomorrow at 8:30 p.m. Don't forget to watch tomorrow, get connected, and also share this video with others. Every time when we discuss anything, we want at least one more life to be saved from COVID-19. Thank you. Thank you, Shailenji.
Thank you, sir. Thank you so much.